Hi, today I'm going to be talking about Scanxiety and what that is, and just ways that, first, what is Scanxiety, and then ways that I'm trying to combat it, and my schedule of scans, just like, which are now just my, like, routine, I guess. Um, but first off, I would like to say shout out to the Fight Colorectal Cancer Organization for sending me the T-shirt that I'm wearing, and this is their strong arm selfie T-shirt, and the Fight Colorectal Cancer does a number of things, but one of them's giving resources for patients, and grant money for research, philanthropy, just general colorectal cancer awareness, and advocacy politically. So that's cool. And then also this hat's from Cassie Hines, which I went on the Cassie Hines Shoe Foundation. They do Base to Summit, which is a cancer camp every year. This was their second year doing it. So it was a great program. It was beautiful in northern Michigan, and I'll be talking about cancer camps. The two I went on this past summer in another video, but I always like to just share resources, and because half the battle is just finding resources online, when you're undergoing things like pretty similar things that I did. Also, I apologize always because I had brain surgery, which affected my speech. So sometimes I slur my words, and sometimes I'm a little bit hard to understand, I think. But anyway, it is what it is. It is what it is, right? So anyway, okay, so it's back to the topic. Scanxiety. So what is it? So everyone, cancer patients, survivors, whatever you call yourself, have to have scans pretty regularly. So for me, I have to get scans. Ow, stop. My stupid cat is always bothering me. I have to get scans once every 6 months for my brain, because I had, like I said, a brain tumor. So I have to get MRIs once every 6 months for that. I also have to get what they call a sigmoidoscopy. That's basically like a little mini colonoscopy, if you will. I have to get that once every 3 months. And then I also have to have my annual colonoscopy. And I have to get PET scans or CT scans once every 3 months. And the latter of those two, that I'm on that 3-month timetable for the next 2 years. And yeah, it is what it is. But with the scans, every time you have to go in for a scan, you get some kind of anxiety. You get nervous about them, of course, because you want the results to be good. And if the results aren't good, it could be potentially devastating. So I'll use my brain as an example. I was in Michigan with the Cassie Hines, and I had started feeling really dizzy and confused. And turns out I had just started hormones because I had started menopause early due to going through radiation a couple of months prior. So I'm on hormones to help with the hot flashes and whatnot, and some of the other symptoms from that. So the hormones I'm on makes me feel, one of the side effects is potentially confusion, slurred speech, which is really not great for me, obviously, in my situation, and then like memory, like loss, like all these things. So I was like, yeah, sitting there and just feeling really confused, and it was like a cross between vertigo and a panic attack. And it was really scary, obviously. And I had 2 of those when I was there, and my mind immediately went to, oh my God, it's a brain tumor. And I had like a week or two after that, was scheduled for a brain MRI, so that was also weighing on my mind. And it turns out my brain, according to my neurosurgeon, was perfect. Um, well, I don't know if my brain's perfect, but I'm cancer free up there still. So yeah, it was fine. But it was really scary. And then I had talked to my survivorship doctor and her nurse, and we decided to reduce my dosage of the hormones. I'm now taking them every other day instead of every day, and I just need to make sure that I'm eating a full meal when I'm taking them, because that lessens the chances that I'm gonna have like those symptoms. So anyway, but yeah, having that is really scary, having that experience. And with the PET scans and the sigmoidoscopies, it's also, really, really scary to think about. Like every time that you go in for a scan, you're possibly learning, something is wrong. So, to combat that, I have been, well, partially to combat that, I've been going to an oncology psychologist, which has been really great for me. Have only seen her twice so far, so this is very new, but it's really helped me put things into perspective, not just Scanxiety, but a lot of different things that I'm trying to work on. But yeah, it's really helping me to put things into perspective and just trying to like have some semblance of normalcy. And I had told my husband this and a couple other people that survivorship in some ways is harder than actually going through treatment like chemo and radiation and surgery. It's not as hard physically, of course, but mentally it's, I think, harder. And when I went to the Colorectal Cancer Alliance, they had their national the convention called ALACON. I went to that. One of the panels I went to on survivorship talked about this, and it talked about that colorectal survivors, the symptoms once you're after treatment and you're doing well. One of the main concerns is the mental health over the physical symptoms, which I've been finding to be very, very true. And it's it's just really difficult because in treatment you're constantly working towards getting better, right? You have a surgery and you have chemo, and like for just me personally, from my experience, it was like I would do chemo every other week, and it's like every week we're shrinking the tumor, we're getting a little closer to the goal of being done with chemo, being done with radiation, but that kind of thing. Whereas now I don't have now that I'm out of treatment, it's hard because it's like maintenance mode, and it's just like, okay, now I'm just worried about the cancer coming back all the time. So that's another thing I'm working with my doctor on, my psychologist on, is trying to squash some of his fears and stop worrying so damn much, which is easier said than done. But scans certainly don't help with that. But it's a double-edged sword, because it's great that you're getting all these scans, because if the cancer does come back, they're going to catch it a lot earlier, and you're going to you have a better outcome if the cancer does come back. Mother cat. But it's mentally, it just puts you through the ringer that much more. So anyway, but if anyone has any questions about any of this stuff, I would be more than happy to share more experiences with you guys. Yeah, let me know in the comments if you have any questions. Okay, thanks for watching as usual.